Not all fibroids require surgical intervention, and not all fibroids requires treatment. Did you also know that you can conceive whether you have fibroids? Carry that pregnancy to term successfully. Welcome back to the Nursing Moms. I'm Nurse Janet, and in this specific video here today, I want to talk about uterine fibroids. What are uterine fibroids? What causes uterine fibroids? And what are the signs and symptoms that you can have to tell you that you are having uterine fibroids? Uterine fibroids are non-cancerous growths inside a woman's uterus. Actually, most tumors are either benign or malignant. The malignant are the cancerous one, and most of the tumors are always benign, and uterus fibroids is one of them. The fibroids are non-cancerous. This means that they don't have the cancer cells, and they always occur during the childbearing age in a woman's life. They vary in different sizes. The location, we have different types identified by the location that the uterus fibroid is. The size of the fibroids ranges from a seedling that is undetectable to large masses, and again we can have either single or multiple fibroids. It all depends. Types, we have different types of uterine fibroids, and we have the intramural, which is the most common type of uterine fibroids and occurs in the muscles. We also have the subserar uterine fibroids. This occurs mostly on the outer layer of the uterus, and we also have the submucosal uterine fibroids. The severity of all these depends on where it's located. What causes uterine fibroids? Actually, the exact cause of uterine fibroids is still unknown. However, the risk is associated with smoking, drinking alcohol, obesity. If you are using any estrogen therapy, and to this group who had what we call early menarche, actually when you started your periods early, there is this long exposure to estrogen hormone. And again, late pregnancies. Actually, if you delayed having your first pregnancy, that is the first pregnancy in your 30s, there is that prolonged exposure to estrogen hormone. And actually this can lead to having fibroids. The other things that can predispose you to having fibroids are genetics. That is, when your mother or your sister had fibroids, it's actually genetical too. And other things are estrogen therapy, hormonal changes in your body, and maybe you are getting some therapy for estrogen. Fibroids are estrogen dependent, and this means that during pregnancy the fibroids too tend to grow together with the baby, and as long as the estrogen levels are high in the body, this will keep on nourishing the fibroids. What are the signs and symptoms that will tell you that you have fibroids? Actually, the other person can be having fibroids and the other one to have, but again the signs and symptoms differ. It all depends on the size of the fibroids, the location, the numbers. We can have multiple or even single fibroid, and the size can be undetectable or large masses. All these will lead to the kind of symptoms that you will be experiencing. It also depends on the location of the fibroids, and actually one person can be asymptomatic. That means that one person cannot experience any symptom of having fibroids, but the other person will be experiencing severe symptoms like bleeding after sexual intercourse. You can have intramenstrual bleeding, that is bleeding in between your cycles. You can have heavy prolonged periods. You can be bleeding in clots, and you can have pelvic pressure, pain and discomfort around the pelvic region, periods lasting for more than 1 week actually, and you can have difficulty in emptying the bladder, that is difficulty in urination. You can have what we call urine stasis. You cannot completely empty your bladder, and constipation, backache, spotting, and lastly you can also have difficulty in conceiving depending on exactly where this size of fibroid is allocated on. Treatment depends on the severity, the location, the number of fibroids, and the size. It actually can be small size to large masses, and lastly whether you need more kids after this. You can have myomectomy, that is removal of these specific fibroids but preserving the uterus. And you can also have some medications that can be used to shrink these specific fibroids. And actually, those that are not causing any harm, they're just small and they are not along the way that can interfere with, maybe with anything to do with fertility. Actually, they are just seated there, they are not growing, they are not causing any harm, they need not to be removed. Yeah. The complications too depend on the severity and different things. Actually, you can be anemic, it can lead to infertility, and it can also lead to interference with other organs like bladder, if at all it's pressing much on the bladder.